Hacemos todos los martes lo del food pantry, que pues se les da comida a la gente. Eso es lo que hago aquí. My name is Roxana Bonilla. I'm from El Salvador. I was active, playing sports in school, volleyball, all of this stuff. I was running the tracks, and I felt the shortness of breath. To me, it was, I guess, normal. Until all my coworkers, "Are you okay? You sound this, you sound that." Then my sister said, "You sound like you have asthma." She was the one that motivated me to try to get the lungs checked out and see what was going on.
So what condition she has is, we call it as tracheobronchopathia osteochondroplastica. This condition is genetic, and it slowly progressed for her, leading to worsening shortness of breath. What I was expecting based on the CAT scan is that, yes, she would have some narrowing of the trachea, some calcified nodules I would see, but to this extent, I have never seen before, or never even seen pictures or literature about this extent of the disease. And that's why we had referred to other places.
So I was like doctor to doctor. The first doctor that saw me, it was a lady. It was in Dallas. And she's like, "No, I'm going to refer you to another doctor." So she did. I did went to the doctor. He charged me like $8,000, $9,000, just to do the same thing Dr. Patel did. What happened was I came out worse than when I went in. And I got concerned. So my mom came and she's like, "I'm going to take you to Houston." So we did. I went to Houston. I took all the packages, that I have. And they say the same thing.
I had even shared her pictures of bronchoscopy to different places, and everybody said, "Hey, this is a very challenging case." Nobody was willing to do anything to her.
So I talked to Dr. Patel and I said, "You know what? I give up. The doctors, I went here, and I can't find somebody to do the procedure or the surgery that I need."
Seeing her in my clinic right here on this chair, over days and months, her symptoms are getting worse. If we didn't do anything, or we didn't offer her anything, she would have nothing left.
He talked to me, he's like, "I can do it." I was like, "I trust you, so do what you think is best."
That's the time, I consulted Dr. Wickwire from ENT and asked him if he could do a joint case.
We were able to meet in the middle and give her kind of a full tracheal or full windpipe treatment that helped her breathe considerably better. We started with kind of a conservative intervention, primarily focusing on the upper part of her airway, and then she did really well from that, proved to us that we were able to keep her safe during the surgery, and so we took her back about 6 months later to repeat the process and give her a more holistic, comprehensive treatment of her airway.
I think I'm able to walk now a long distance without me getting tired, short of breath. Even playing with my kids. I want to be there for them. I want to do things with them, play. And if I didn't take care of this, it was not going to be, I guess, possible.
And for somebody who has given up hope, to get hope restored is tremendous. And that's rewarding too for us to be part of that journey and to see the light come back into somebody's eyes and say, yeah, maybe there is hope for me.
It makes you really happy when you see somebody, who cannot breathe and now is able to breathe and do her normal work and everything.
It's one of the most satisfying parts of my job is working with patients like Roxana.
I would not, I would say, have my life back without them. Dr. Patel and Dr. Wickwire, and all his team, Dr. Patel's nurse, everybody was willing to help, and they treat me really good. So that's all I can say.
That's what the biggest motivation, biggest drive for me is, the happiness, the joy on the patient's face. That they get better, they can go home.